Phases of the step. Heel touch or initial contact. Foot plantation or load response. Mid-stride or medium support. Heel out or terminal phase. Toe ferro or pre-oscillatory. Oscillation phases. Traditional. Acceleration or initial oscillation. Medium oscillation. Deceleration or terminal oscillation. Displacements of the center of gravity. Higher at mid-step and lower at heel strike. There are vertical displacements that follow the transfer of weight between the lower limbs during gait. Width of the base. It is the latitudinal distance between the feet. Observation of normal gait. Frontal plane. Pelvis. The EIAS, upper iliac spine, rises during the double support phase and reaches its maximum point when the opposite leg removes the tip of the foot. The lowest position occurs in single support. When the heel touches the ground, it rises a little. Hip abduction and adduction. The abductors contract eccentrically to counter the adduction of the hip joint in the double support phase. The abduction occurs during the withdrawal of the toes. The hip then adducts again to assume the neutral posture. Sagittal plane. Pelvis. Tends to anteversion, which decreases during double support and increases again at the moment the weight is projected forward. Hip. Flexion occurs during the thrust phase and extension during the support phase. Knee. The first flexion occurs during the initial support phase with a cushioning function. The second is stronger and longer and occurs when the toes are withdrawn, at the beginning of the forward thrust. Ankle. The first flexion precedes the heel strike. The second flexion occurs during the entire simple support phase. A plantar flexion occurs at the toe-off. Kinesiology of the hip joint. It is made up of the three bones that form the pelvis, ilium, ischium and pubis, that fuse together at approximately 18 years of age to form a cavity directed laterally downward, called the acetabulum, and the femur, whose head fits into this cavity. It is bilateral and the right and left sides are joined by the sacrum with which they are firmly articulated forming the pelvic girdle. The hip is the most proximal joint of the lower limb. It is a synovial articulation classified as a ball and socket type spheroid. Anarthrosis, is triaxial, and despite its great range of motion, presents considerable structural stability. It has a strong, dense capsule attached to the limbus of the acetabulum and femoral neck. The anterior part is denser and is reinforced by three spiral crossing iliofemoral, pubofemoral, and ischiofemoral ligaments, limiting mainly hyperextension. In its lower part it is thinner and looser, since the bone structure itself helps maintain stability. Another ligament present in this joint is the round ligament or femoral head ligament, which crosses the incisure of the acetabulum and attaches to the femoral head. It is believed to have a function related to joint stability. Another structure that helps maintain stability is the labrum, which lines the edge of the joint, deepening it and protecting its margins. The hip is a joint that presents differences between genders, being higher and narrower in men than in women. Another difference is the femoral head, which is generally smaller in women. The distance that the neck of the femur gives to the joint limits the possibility of limiting the range of motion by collision or contact with other anatomical structures. The movements performed by the hip joint are flexion, extension, hyperextension, abduction, adduction, rotation, internal and external rotation, and circumduction.